Smaller dogs may be more susceptible, but larger dogs and cats can also have a trick kneecap. But when do your pets need surgery? We answer that question in this morning's Ask the Vets.
Good morning. I'm Dr. Eric Anderson from the Ballston Spa Veterinary Clinic, and today I'm going to talk to you about the luxating patella, or the trick kneecap. This is a congenital condition, something that dogs and cats are born with, that occurs mostly in small breed dogs like my friend JP. But it can occur in any dog breed, and it can occur in cats as well. What happens in this condition, this is a model of the knee, is that the kneecap, which is here and embedded in the ligament that runs along the front of the knee, the patellar ligament, pops in and out of the trochlea, or the groove that it should stay in. Now, symptoms can vary greatly depending on the severity of the condition, and we grade the condition 1 through 4. With a grade 1 patellar luxation, the patella rarely pops out of the groove. With a grade 2, a bit more frequently, but the dog can usually get it back in themselves, often by straightening their leg out. In grade 3 and 4, the kneecap is almost always out of the groove, and it becomes painful, and the dogs become symptomatic. So what can we do about it? It's a surgical repair. For grade 1, we don't recommend surgery, and dogs are rarely symptomatic. And by symptomatic, I mean they're lame, they're limping on it, or they're walking funny, they're having problems with their leg. With a grade 2, depending on the amount of symptoms, we will sometimes recommend surgery. With grade 3 and 4, where the kneecap is out all the time, we recommend surgery to repair this. For a successful surgical repair, we need to do 3 things. Number 1, we need to modify the groove, or the trochlea, and make it deeper, because it's almost always very shallow in this condition. Okay. Part 2 is that we need to transpose or move the tibial crest. The tibial crest is the area here on the top of the shin bone where the ligament is attached, and it's typically in an angle like this. So it is physically pulling the kneecap out of the groove. So we're going to use a small bone chisel, cut along the dotted line, and move that over to bring that ligament into nice alignment, and then we'll put it back where we want it with a small bone pin. And the third part, when we close this surgical incision, there's a nice layer of tendinous holding tissue on the outside of the joint, and when we close that, we're going to overlap it so that it also holds that kneecap from moving to the medial side or the inside of the leg. That's it on patellar luxation from the Ballston Spa Veterinary Clinic. I'm Dr. Eric Anderson.
If you have a question that you'd like to ask the vets, just email it to askthevets@cbs6albany.com.